Hi everyone. Today I wanted to speak to you on 5 side gigs that could keep you as a medical practitioner making some extra money. 5 side gigs that will also value your independence and your expertise. So number 1 on that list is telemedicine. So I have found through talking to many colleagues, probably the easiest way to do this is to set it up on your website. There can be on your drop-down menu, a request for telemedicine. The tricky part is if they're already a patient, then you're obligated in network to stay with their insurance company. And so you would be billing for that visit. If they are not a patient, there has to be a link to a credit card, and posting your fees every 15 minutes is X number of charge. So you can do it any way you want, but I found through talking to many colleagues, that's the easiest way to do it as a add-on to your website. Number 2, medical writing. So in the past, I've written a couple of journal articles myself, but in the past, we have not gotten paid for that. Times have changed. There are companies that are looking for your expertise, and you can privately contract with them to charge for your blogs, to put your name behind their product, to link your expertise to their product. So these are all monetizable. You can certainly search the internet and see what those dollar amounts are, and offer up your expertise at the very least through LinkedIn, which is where I go if I want to post my expertise and see if anyone's interested in having me write for their brand. At the same time, you're also advertising your own brand that way. Number 3, consults. So there are many healthcare companies, in my case, medically related companies like shoe companies, who are looking to consult me on their designs, what their offerings are, if they think there's a market for that. And certainly there's a fee that you can charge for your consults. So I would look into it. Again, I advertise that on LinkedIn, but there's certainly many ways you can do that through social media sites and offer up your expertise as a consultant. Number 4, teaching. So teaching, many have stayed in touch with their medical schools and certainly can offer courses there, but also you could have a side gig or a main gig as a residency director. So that's a salaried position with benefits. You can also offer coursework to residents. Again, monetizable. And lastly, and this is a double-edged sword, it's something I choose not to do, but you can be an expert witness for law firms. So that is, you become the witness against someone else in your own profession. And we'd all like to think that these are terrible people, but sometimes they're not, and you could affect their livelihood that way. So, but if you do have someone you know and trust who is an attorney and does malpractice cases, it certainly is a side gig. So these are the 5 top side gigs that I have found, and how to generate side hustle money as a medical practitioner, as a physician. And so again, recap, that's telemedicine, medical writing, being a consultant, a teacher, and a expert witness. Hope it helps. I'm totally committed to keeping physicians independent and in charge of their own brand. Dr. Poe Raval. If anyone wants, certainly follow, and there's a link in the bio for a book to start the practitioner on their own office journey.